Welcome everyone. My name is Jason Kurchik and I am a nurse and public health student at the University of New England. I am honored to be presenting to the Bill and Melinda Gates Foundation today to discuss maternal mortality in Afghanistan. Since the year 2000, the Bill and Melinda Gates Foundation has been finding innovative ways to impact the world globally with real change by enhancing access to healthcare and reducing extreme poverty. In 2011, speaking at the Foundation's annual conference, Melinda Gates stated the following regarding the Foundation's goals. We see that when health improves for a person, they're able to access something like a family planning tool, so they can have a much smaller family. They can then feed that family and educate their children. A virtuous cycle begins of economic opportunity for that family. And it's that virtuous cycle from health all the way through education that we're interested in. One way the Foundation can implement real change is by addressing the maternal mortality rate in Afghanistan. We know that when the health and happiness of mothers and child are not met, it correlates to bigger issues that are not being met. This case study presented here today will outline the problem and provide ways to which the Bill and Melinda Gates Foundation can help. Our objectives today will be to examine the problem, what it is, and the methods to improve outcomes. We will explore the proposed interventions based on current evidence-based practice and how to evaluate those interventions to determine if they were successful or not. We'll look at some of the potential challenges and barriers that may hinder our interventions. And finally, we'll examine the changes that are hoped to be achieved through use of a logic model. So when looking at our topic today, what is the problem? Well, simply stated, Afghanistan has the worst rate of maternal mortality in the world. A survey completed in 2002 showed the rate was 1,600 for every 100,000 live births. Some recent studies have showed improvement, but the validity of those studies have been questioned. And regardless of those new numbers, Afghanistan still has a long way to go. What you're looking at now is a social ecological model. This is a tool often used in public health to identify factors that contribute, influence, or cause the public health issue. For each level, we'll look at what's helping and what is hindering the problem. This will help us identify topics that are having the biggest impact on maternal mortality in Afghanistan. At the individual level, lack of education contributes to the high maternal mortality ratio, whereas access to education actually helps outcomes. Let's look at sex education. Well, it's seriously lacking for Afghan girls who do not go to school. Many of the issues surrounding this have to do with family roles and religious views. Several articles have referenced one particular study where only 16% of 15-year-old girls surveyed knew how babies were made. Women who did attend school actually had fewer pregnancies and were better able at getting skilled attendance at birth. A family's values, cultural beliefs, and socioeconomic barriers have a huge impact at the interpersonal level. Access to reliable transportation makes it extremely challenging for women to access appropriate health care in time. The poor infrastructure of the country makes travel very difficult. Improved transport helps this issue. So one great way transport can be improved is by developing local outreach teams who are actually familiar with the geography of the area and can therefore create better options of transportation. Provider access also fits into the interpersonal issues. The lack of well-trained midwives and clinics contributes to poor healthcare access. What has helped, however, is that in 2005, the Ministry of Health established maternal mortality as a key priority, which actually led to a major focus on the recruitment and training of midwives. Research shows that mothers assisted by skilled health workers is the most effective intervention for reducing the maternal and neonatal mortality rate. At the organizational level, healthcare insurance carriers present both benefits and challenges. The majority of the population cannot afford insurance or healthcare services whatsoever, so skilled healthcare providers are only available to those who can afford it, which creates less equity in health service utilization. If a health insurance system could be supported by the government and families were able to contribute a small portion, perhaps overall access to services and medications could improve. Any efforts to improve maternal mortality must first recognize that Afghanistan is a country that has seen decades of instability, war, and violence, especially against its own women. After the Taliban rule ended in 2001, the health system was essentially destroyed, and it hindered maternal mortality efforts that decrease access to health care for women. However, efforts by the Ministry of Public Health have actually helped to strengthen community coalitions and initiate community midwifery education programs. As with the community level, war and conflict has impacted the rise and fall of the Afghanistan government, which has major consequences on policy. However, through these challenges, the new Afghan interim government established the Ministry of Public Health that has been working effortlessly to improve the maternal mortality rates. Through working with international donors and many non-governmental agencies, a basic package of health services policy was crafted and launched, which actually helped increase access to health care. So now that we have looked at issues that have helped and hindered the maternal mortality rate, we want to ask, what interventions can we implement? Well, first, by increasing midwifery training programs, the issue of access has improved for mothers who need care. We also need to address the individual and cultural needs of the society. If we do not understand the autonomy of the people, well, we can't expect people to follow through with the interventions that we want to give them. By conducting maternal and family surveys, we can gain knowledge of which interventions will best meet the needs of women in the community. An intervention to address the challenges with the country's infrastructure must also be examined. A global campaign would establish funds and greater awareness to ensure access of reliable transportation. And finally, an important and perhaps the most critical intervention in nursing practice is education. As a public health nurse, the client and families need to know what best practices are to make informed decisions, not only for themselves, but for their families, that they're aware of the healthcare choices, and that they have the knowledge and tools and resources available to them. After we initiate our interventions, we need a method of evaluation to know whether or not the interventions actually worked. And this evaluation tool will know that increased midwifery training programs worked because reporting will reflect that more mothers have access to skilled attendants during birth. This will be measured by the reduction of maternal and neonatal deaths. When conducting maternal and family interviews to better understand the cultural needs of the family, we will know the intervention worked if greater acceptance of healthcare practices are being implemented. This can be measured by a decrease in median household sizes. And finally, our interventions of collaborating with key players in policy, education, and public health agencies will be determined successful if more adolescents receive family planning and sex education training, and that they have better awareness of the resources available to them. And this can be measured by the number of participants attending and receiving education. So here are some of the potential challenges and barriers we have with the interventions we want to implement. Well, first, let's look at funding. Without funding, access to resources will not be possible, which therefore limits the amount of resources available to ensure proper intervention. Without an understanding of the cultural barriers, we cannot deliver care that is needed. Parts of Afghanistan are still tangled in conflict, which actually puts people, and even those delivering care and resources, at risk of reduced security and danger. So safety is an issue there. And as mentioned several times already, the poor infrastructure and geography of the country makes accessing many towns and cities very challenging. So a great way to gauge the interventions and see how all the links of the chain come together is with the use of a logic model. The model allows grant writers and policymakers the ability to put the interventions together and answer, if you do this, then this will happen. And if this happens, this will be the outcome. So as we can see here, the model illustrates in this case study that if we strategically place midwifery clinics, then we can increase access. If we increase access to these programs, then we want the outcome to be greater acceptance of maternal health interventions, which therefore will lower the maternal mortality rate. I want to thank the audience, and especially the Bill and Melinda Gates Foundation, for the opportunity to speak on this topic today. I hope that the information provided in this case study can start a serious conversation about ways to improve the maternal mortality rate in Afghanistan. Thank you.